Welcome to ChiroSphere, where we talk about all things chiropractic and some things, well, not so chiropractic. I'm Dr. Ray Foxworth, your host for ChiroSphere and CEO of ChiroHealth USA, the network that works for chiropractic. Today, we have one of the best in the field of chiropractic coding and billing joining us, Sam Collins. Known far and wide as the billing expert for chiropractic, Sam has a knack for breaking down complex coding challenges into actionable insights that practitioners can use immediately. He's a member of the World Health Organization ICD-11 Coding Committee and serves on the Optum Health Coding and Reimbursement Committee. He's also a trusted resource for state boards, attorneys, and the VA, that's VA medical centers, I'm assuming, when it comes to navigating the ever-evolving world of coding and billing. You may have read his expert insights in dynamic chiropractic and other industry-leading publications, but today we get a chance to hear from him directly. From the latest updates and coding tips for streamlining your billing processes, this episode, I hope, will be packed with invaluable advice. So welcome, Sam.
Well, thank you. Wow, that introduction is pretty good. There's a lot going on there. Now, I do want to point out that doesn't mean I work for the insurance companies. I just happen to be an appointed member of the board, so I get to see a little bit of both sides.
Yes.
And I always remember when at the end of the day, insurance is a business. And they're there to make profit for their shareholders. And maybe that's what's wrong with our healthcare system. But nonetheless, it does give some insight, because I think the main factor is we want to make sure we're getting reimbursed properly. We're getting the most that we can. That's reasonable, like anybody else. We are a business as well.
Yep. Actually, I have this peppered into the questions later because in my background, I certainly have this network that's a nationwide network, but we aren't involved in the insurance world directly. But in my state, we woke up one day and had managed care hit the state, and they had like 5 networks, your Aetna, Cignas, and all. Not a single one of them had a chiropractor in network. Yet we had, $1,500, $2,000 of chiropractic care available for 195,000 covered lives in the state health plan. This money
in network. Well, and then maybe that's a good thing, because if you're not in network, do they have out-of-network benefits? Because here's what's interesting. There are plans, and I will warn people, be careful of joining. And I'll give an example. I had someone about a month ago that said, "Hey, Sam, I was billing United, and I was getting a little over 100 a visit. And now that I joined, I got $60. And I said, "Correct." And they go, "Well, what happened?" You joined. Always look at the big picture of that. If it's not bringing you a patient you can't otherwise touch, I generally would say I'm not joining something unless the patient otherwise has no benefits. And then I got to look further to go, does it pay me something reasonable? I mean, if I'm joining something getting paid $26, that doesn't work for me. That hasn't been reasonable since the 70s.
Yep, no doubt about it. One of the things, whenever we started that network, we actually won the contract for the state of Mississippi. And it's like, oh, crap, what do I do now? I've never had a network before. Somebody had to step up and get us there. And it was funny to watch, Sam, because over the years, part of our responsibility was to do utilization review. And, what doctors don't understand sometimes is the guys that are helping in utilization review, our job is really to help get the doctors paid, not figure out ways to keep them from getting paid. And so, I used to get beat up on by some of my colleagues for, oh, Ray's working with the dark side.
Right.
And the reality is you better be damn well glad there's somebody willing to work with what's referred to as the dark side, because the saying, if you're not at the table, you're on the menu.
Yeah, I like that. In fact, that's so true. I say it all the time, because I've worked with a lot of cases like that providers are there to try to implement to give the best possible benefit for the patient. We have to understand what are the guardrails to that. And it's not as open-ended. I mean, chiropractic philosophy, my goodness, I come from a chiropractic family. I'm 64, and chiropractic's always been the profession of my family because my dad was a chiro. And if you look at chiropractic philosophy, which we all believe in, the healthcare side of it, that's true. And I believe it. And I think we see it. However, we got to remember, is insurance, we say health insurance. Is it really? Or is it insurance? And so you have to look at what they're looking at is when the patient gets reasonably better, they're going to cut them off. And you've got to look to go, they're not going to pay for that true health care. They're paying for, hey, in the absence of having a big disease. And the tough part is those guidelines, they fit an average. And so if you told me the average person has a ankle sprain, grade 1, that's going to be better in 2 weeks. The problem is often when they look at, they assume everything is there. So it becomes very important for doctors to understand utilization comes down to what are you documenting in the sense of severity, not only the diagnosis, but complicating conditions and comorbidities. But there's still going to be a point there that it's not going to be truly health care. It is sick care. And there's a difference. And this is why we have to put people into more of a healthcare, which means they're going to pay for it. I mean, let's face it. Does the insurance company pay for you to eat good, healthy food, go to the gym, sleep more? No, that's up to
That's
us.
our
And there's
report.
a value we have to place.
Yep, no doubt. And that is a shift. Fortunately, I think we will in the future see more movement towards things that help us stay healthy, and maybe health insurance will kind of evolve in that. Who knows what's going to happen with Make America Healthy again, but at least the conversation is occurring that, folks, maybe you ought to focus on keeping people well rather than when they crash and burn. But, we'll see what shakes out in Washington.
Well,
So,
there's a movement towards that. To give you an idea, they're looking at models that pay providers better for good outcomes as opposed to just treatment. It's like, so providers will be, according now, of course, everyone's like, well, wait, my outcome is better. Well, that's going to be the motivation. So there's a little part of that, but you're exactly right. It's to change and start to get where we start thinking of, maybe let's not wait until we get sick. And it's partly the model is insurance companies rely on that in a way, because they want to make sure, you're not sick enough. So, well, let's keep them healthy. In fact, Kaiser's figured that out. They've realized keeping people healthier saves them money because they're the insurance as well as the provider. So it's a vested interest to kind of work both ends of that.
yep. I remember at one point I was asked to chair a committee for workers' comp reform in our state by the governor. And, when we looked at your workers' comp system or really just general health insurance in the workers' comp system reward all the wrong things. It rewards doctors for doing more, doing it longer, the breadth and depth of care. And then it actually rewards the employee for not getting better, because in our state, you had to be off 5 days, 5 consecutive days before your workers' comp benefit would kick in. So guess what happened? Somebody with their back, they got a minor tweak and they're off 3 days. Guess what they do? Hey, doc, you think you can go ahead and take me off a couple of more days because I'll get my workers' comp benefit? And so, when you got a system that rewards all the wrong things, what do you expect is going to happen? I mean,
That's true. That you see that often in California, by example, if you have disability, if you're off for only 7 days, you get nothing. Once you're off for 7 days, they'll pay you for the first 7 and the next. So it's kind of like if you're sick for 6 days, well, you might as well be sick for a 7th. And so it's really just a matter of how is the system being implemented. And you're right. They're rewarding the wrong things and incentivize. And if we begin to change that, you will incentivize it to be a different way.
can you imagine what would happen if and I know it's not practical, but in a perfect world, what would happen if when somebody got injured on the job, they didn't get paid until they went back to work? They got the benefits when they went back to work.
Well, that would be the tough part is that, when a person's severely injured, but, I've seen it before. I had a patient with, this is not a joke, that he came in and he says, well, I'm like, well, this is not bad enough. I think you can still work. Let's do this. And he goes, well, if I get off work, because his incentive was he gets paid about 80% of his salary when he's off work. So he didn't come in for 2 weeks. And one of his friends had come in and they said, hey, doc, he's going to another doctor because he put him off on disability. So there was a vested interest for him to say, well, I might as well take off work if I get 80% for not working. So there's a little part to that, how we incentivize. And I think we're moving there, but it's very, very slow.
And we're off topic, but I love this anyway. I mean, it's just conversations I think we ought to have as practitioners. Something that blew my mind when I was in practice, if I were to see a workers' comp patient and let's say they ended up being on disability, you would be surprised. You probably wouldn't be, but something like 50-60% of the spouses of someone who has had a workers' comp injury that's compensable and they're disabled and they're able to stay at home and get 80% of their pay, guess what happens to the spouse? They end up with a workers' comp claim. And no kidding. So, I mean, literally, when I was working with the Workers' Comp Commission and talking to them, they have the data. And it's like, you would be surprised how many husband wives have it, because it's almost like if the wife's off and not having to work, she's getting 80%. The husband's going like, what the hell am I going to work for? Why don't I? Let me use my back, and now we can travel.
Yeah. Well, and therein lies a cottage. I have a good friend that is actually a work comp investigator to look at just things like that. And he's never without business because they go to your house, they video you and go, what do you mean you're disabled? I saw you out in the front jumping on a trampoline. Or there's the famous one, a guy who said he was disabled in Texas, and they had video of him riding bulls on the weekend. So I don't think you're disabled.
Yeah. Actually, my next door neighbor was one of those workers' comp investigators. And I mean, he would literally come and park in front of the spine where my practice was a spine center with 13 MDs, 6 neurosurgeons, orthopedic, if it was spine, it was in that building. He spent most of his time in front of the building, videotaping people coming in and out of the building, and they would walk into the building entirely different than they would walk at home, on the sidewalk. It just gaming the system.
Part is that the people who are really hurt, that's what hurts it, because then you have to deal with both ends of that. And again, it's maybe the keep people healthy to begin with. And that's kind of the chiropractic way we've always done, is like, let's not wait to be sick. The body heals itself in many ways if you do something regularly.
Yep. Get out of its way and let the body do its job, right? So you mentioned your dad was a chiropractor from a chiropractic family. What got you into the billing and coding side of the profession?
I was always kind of the billing and coding person in my dad's office, frankly. By example, when there were reports to be done, I would do them. So I always hated doing those reports for like ASH. My dad didn't mind them because he didn't have to do it. So I've always kind of done that. Well, in the late 90s, my dad was moving on, and I got introduced to Howard Ross, and he knew that I did some lecturing, some seminars. I said, well, come work with me. And that evolved very quickly from 1998 to now, where I've really just focused on that end. And like you noted, I'm part of WHO. I've been on lots of committees. I'm kind of the expert when it comes to it. So it's something that just kind of evolved. And it's something that I enjoy because it still allows me to kind of keep my foot in the profession. And for me, I'm proud of, because I wish my dad were living to see the things that we're doing now in chiropractic, where we've expanded. There's some areas I wish were better. But when you think of now how people think of chiros, and I'll give an example. When I was about 11 or 12, so we're talking 1970, 71, I had someone say to me, your father's not a doctor. Now, I knew exactly what they meant, because this person, his dad was an MD. But to me, it was funny because my dad was a doctor. In fact, my dad's first part of his practice was delivering babies up to, I think, 1968 in California. You could do that. So I knew what he was, but I knew what he was trying to state. And what I'm bringing that to is fast forward now with my grandkids, my sons, or people that know me. When you talk to someone about going to a chiropractor, think how that has changed and how we are looked at as a profession. In fact, to let you know, the physical therapists envy us, because they wonder, why is it that people will pay us cash that they won't pay to others? And it's because we really give a value. They're also jealous because we've branded ourselves and not been dependent upon the medical side to do what we do, where physical therapists are within that, purview. They're kind of constricted. And so I think because of that kind of cowboy style that we had to bring up, we've expanded. If you look at the respect in chiropractic, if you go to the Olympic Games and you're a chiropractor working there and you think you're going to watch the Olympic Games, you're not. You're the most popular practitioner there, because athletes have learned when they get regular adjustments, their body performs better. Just as simple as that. That's why every professional team has one, if not several. So we've really gained, and that's something I'm so proud of, to kind of hopefully been a small part of that, to expand that. People are saying, yeah, we want these chiropractic benefits. They are better for us. And in fact, there are studies that are beginning to show, and again, it's going to be hard because drug companies push back, but if someone goes to a chiropractor, does it actually save money to the healthcare system? It actually does. Prevent it. Why wait for a surgery? Do something beforehand.
Yep. So as a member of the WHO, the ICD-11, I guess, coding committee, what's on the horizon for us? What the doctors need to start being aware of, and when do you expect that transition to occur, or has it occurred?
Well, it's occurred in 63 countries, not the U.S. To give you a little background, I've been involved with ICD-11 since 2013, and the world adopted it 2 years ago now. Not every country, but a lot, 63. The U.S. is a slow adopter. This will sound funny, but when we adopted ICD-10, in 2015. Do you know when the world adopted ICD-10? 1990. Literally, we were
Johnny on the
15.
spot, aren't we?
Well, I'm not going to say this is going to happen quickly, but what the big thing about this is that it's an open source. So no longer will you have to pay the AMA for licensing. It won't require updates because it's continuously updated on the site. So the ICD-11 is a completely online version. It's searchable much like Google, so it's easy to find. And they've really granulated the coding better. So like when you look at certain types of whiplash and strain sprain, it granulates it so it describes better what's going on. Like there's subluxations related to trauma. That's a little bit differently. So what it does is it makes it easier to describe. I make it akin to if I describe a picture by saying it's blue and got red, that's fine. But what if I start describing it in a way that says, well, there's a woman with great teal, kind of the difference between a Monet painting and a Rembrandt. It's more detail. And that part I like about it. What I think is also better, though, is that chiropractic's been at the table, hence why I'm on that, to really kind of give that, we're not letting that come out. Because what's interesting, and this also involves traditional medicine, meaning acupuncture, they recognize in the world as chiropractic as being a traditional medicine. And they're creating greater access because the World Health Organization has recognized that it's cheaper to provide and offers really good outcomes. So there's a push towards getting more of this emphasis. And by putting it in the coding, creates something that you can track it. Because one thing this is something was told to me from the director of World Health Organization. They said, for chiropractic to count, we have to be able to count it. So we need to have coding and things that are specific to what we do so that they can start to measure, oh, look at the difference when a person sees a chiropractor. Because how do we measure something that we have never measured? We've got to measure it. And I think that's really going to be the difference. I've always thought I'd love to see a study where someone who goes to a chiropractor regularly, let's look at their overall health. And I mean everything, colds, flus, you name it. Let's monitor what they have comparatively. Like, by example, I've always been a very healthy person. Now, is that maybe a little DNA? Sure. But is it also coming from a chiropractic background where I get adjusted and so does my family regularly? Do we go to the doctor? Do we use all those things? We do not. I would have to put some of that towards chiropractic. In fact, I would say to you, if we could do that, it would show up. The problem is who's paying for that study? By example, remember Dr. Dickholtz that did the whole thing with the adjustment and hypertension?
I do.
It worked very well, but they never really could repeat it because no one really put any money in the study. Because why would Northwestern or any school, when you've got Merck coming in and saying, hey, we're going to give you $10 million to study our blood pressure medication, or you can do the chiropractic one for free? No one's interested in that. This is why we need governments to come in and say, we want to look at what's the best. Because if you could get a single adjustment that reduces blood pressure by 20 points, why aren't we doing that? Well, who controls healthcare? I mean, the reality is it's drug companies. That's the biggest crowd. And I'll give you an example here. When I travel the world, because I go all over as part of WHO, the one thing I'll say about other countries, the U.S. is the leader. The U.S. is at top. We have more innovation. However, the one thing that goes, why is it so expensive? Because I'll give an example. There are drugs that are $18,000 a dose in the US that in every other country are less than $1,000. And it's because we have no control over drug prices in the US, but we can tell you how much we're going to pay a doctor. So something's wrong with that system. And every politician says they're going to do something, but when it comes to it, they don't, because where do they get a lot of their dollars from? From the drug companies. They have the biggest lobbies. So they're not interested in they're interested in placating it. But when it comes to really changing it, I mean, why is it that why do people go to Canada to buy drugs? Because it's literally 10%. And it's not that they're not making a profit in these countries. They just make so much profit. To me, this is politics. Politics is all about people who have money, keeping it and getting more. That's at the end of the day, that's what people vote on.
You know, you talk about having a study that would show that. I'm involved with the Chiropractic Strategic Plan, and one of the pillars of that plan is to make sure that we do have data, and we actually have a tech committee, tech stack committee, or not tech stack, but the Chirotech Consortium. Dr. Jay Greenstein's heading that up, Brad Ross with Infinity, and some others doing amazing work. And we already are gathering that type of data through all the people that are being processed through Infinity. but they've been successful in getting 5 or 6 of the other software companies to open up their data. Again, everything's blinded by, for the patient, but we really are going to be able. We have never owned our data. It's always been owned by the insurance company. And as old docs, the insurance companies know more about your practice than you do. Trust me, that they do. They've got the data. And we've always been at a disadvantage of not owning our data because, if you don't own it, when an insurance company says, oh, we're not going to pay for children's headaches, and they just make it out of a financial decision, but yet we've got data that shows that it is more effective, more cost effective, least side effects. We haven't been able to argue that because they've always owned that. And this is just a pure plug. Doctors, you need to be running your data through a clearinghouse that is participating with the strategic plan, because it will allow us to build more and more data. We can have our researchers, Heidi Havoc, the likes, Katie Pope, all the people that are involved in our research pillar can now be able to tap into that data and tell that story. We've never been able to do that before. And
this is exactly why we have to bill insurance as a profession, because it's the only way to collect it. If it's just in your office, it doesn't get anywhere. And this is going to be the beauty of AI and part of ICD-11. This data is accessible. And trust me, if you can get an AI program to just understand what it's looking for, you can easily gather the data and go, wow, we've looked at 1 million people who've had chiropractic care, and we found it correlates this. Because how do we know that a person who can balance on one leg lives longer and doesn't get cancer? Because there's data out there. Well, chiropractic, no one's doing the study, but the data is available. And like you said, when it runs through that clearinghouse, someone can take that and start to look and go, well, look at the correlation. Now, you can always say correlation is not causation, but when you have a large correlation, not a one-off, that's going to be information that's useful. And that's where healthcare is going. I think that's where chiropractic sits. The one thing for chiropractic, and I think this is the beauty of what this profession does. Tell me anytime someone's been to a medical doctor, and I'm not saying this as a negative, and I'm really not, and they left the office and they go, oh my God, I feel so good right now. If you have a headache and you go to a medical doctor, you do not leave that office feeling any better. Now, there's lots of issues, but let's face it, at best, they're going to give you a script. They're going to call it in. It's going to take 5 hours to fill it. Then you take it and maybe your headache goes away. How many times in the chiropractic office, someone comes in, they don't even know if you're going to help them. They don't even think you can. You adjust them and they're like, whoa, that is really powerful. That's really, in some ways, almost a miracle. And I think that's the type of information we need people to see that. Well, wait a minute, someone had a migraine. They went to a chiro and that migraine was gone. They had back pain where it was almost disabled. I mean, think if you've been adjusted, you're always amazed, like, wow, you forget how well that works. And so that's powerful. I mean, and I'm saying we're the only profession that does that. I mean, if you go to a PT, exercise protocols are good, but exercise protocols don't work in a visit. Manipulation does. It can make an immediate change.
Yep, no doubt about it. Going back to the data and being able to collect it and to gather it from multiple locations. I mean, clearly you got to be involved in the insurance world for that. And that is just going to plug it again. That's one of the benefits of this chiropractic strategic plan is the pillar. We have the pillar in research and you have the pillar in data, and the pillar in research is literally going to allow us. Let's say there's X thousands of chiropractors out there. Can you imagine being able to gather the data from tens of thousands of chiropractic practices and the millions of patients that equates to? And in the medical world, this has been going on for the longest time, but they have what's called PBRNs, practice-based research networks. And so literally, and this is where, we get hung up on, why do I have to document so much? Why do I have to code so much? The reality is when you're documenting and coding, what you're doing is you're painting a picture. It's almost like when you watch the football game on Monday night or Sunday night, you've got the guy who's telling you what's happening, but then you got the color analyst who's really filling in the rest of the picture. And so when you said, take the person with an ankle sprain, it takes 2 weeks, but it's the color analysis, which is your documentation that talks about, well, yeah, it's a grade 2 sprain, but the guy weighs 295 pounds, is completely out of shape. So their recovery is going to be different. And That's really what the coding and the documentation is for, is just to help us communicate the story, if you will. And let's face it, codes, what I've seen happen with coding over time, it used to be, well, here's what I did. But what I've seen happen with the diagnostic codes is, here's what I did and why. And so you're turning a number into, the number is the equivalent of the story. So if you're using this code, you're telling a story basically in shorthand.
Well, exactly. That's the reason of coding. Like, I could go to China, which I have, and though we don't speak the same language, though most people do speak English around the world, coding is universal. Numbers are universal. So if I go to China and say M5450, regardless of that they call it Tongshen, it's back pain. And so that's the beauty of that code, is it allows that. And in doing that, what you're able to do is demonstrate what differences you're making or not making. And this goes to, and I've done so many testimony in court as an expert on different things. And the one thing you'll learn, and I'm sure you've all heard this before, but it's really true. If it's not written down, it didn't happen. Now you can argue it did. I know it did. If there's no evidence of it. That's the thing with evidence. And I think this is, for me, the beauty. Chiropractic, for years, we dealt with this kind of just the philosophy of it. But then over time, we realized they started doing studies that, wow, they found the weight of a dime on a nerve causes a decrease in transmission, which means the body's not functioning as well. That's the data that we can start to collect, that when this happens, when you have this type of dysfunction in a joint, this is what's going to be the outcome. Initially, it's just going to be, I have a little bit of pain, but later you start going, hey, there's some weaknesses here. It's degenerating. Oh, later it leads to surgery. This is where I think chiropractic really, really shines, because we are outcome based.
Yep. When you survived as a profession, when there was no insurance, there's only one reason that you did. You were good at what you did, and people got results.
One thing I said, why chiropractic is, you've seen lots of things. I mean, there were people dealing with magnets. Remember when people used to wear a magnet around their neck, or they were in a copper? Everyone tries something. It always circles back. But the one thing that's been true is chiropractic, because it works. And you can see it over. It's something that's repeatable. It's one thing for it to happen once. You go, okay, then maybe that was luck. But it's repeatable. And it's repeatable among a whole faction. And again, that goes back to that data, that if you take any chiropractic office with back pain, I'm going to argue, and this is just me, I'm going to say probably 85, 90% of people with back pain always improve with chiropractic, period, end of story. Does that mean they're always perfect? No, but they're going to have increased function. When we do a back surgery, why is there a code? There's literally a diagnosis code that says failed back surgery. Why would we have a code for something that doesn't happen? There's a failed, adjustment. And it's because we know if you do a surgery to the low back, you initially will feel better. You take the pressure off, but is it eventually going to fail? Because you can't remove stuff and assume it's going to be functional or put a cage around it. It gives you a temporary fix. If you get a knee replacement, that knee replacement's not going to last 30 years. If you're getting it, you're getting another one in 10 years. So it's better to say, how do I get this knee functional? What's there? Because the body can always adapt. This is, I think it's interesting to see, when you look at a degenerated spine and it's never had any chiropractic treatment, give it chiropractic treatment consistent for a year and take an x-ray again, and you tell me what happens to that degeneration. Does it reduce? You bet it does. Now, I'm not saying it's going back to where you were 20 years old, but imagine if they had a surgery that could do that, they would say that's the best thing since sliced bread. This is where chiropractic can shine, because we could demonstrate that. Show me an x-ray of a patient pre-chiropractic and one post. If they're 50, 60 years old, I'll guarantee you'll see less degenerative changes.
Yep. Jim Parker, and I'm sure you recognize the name, it being a chiropractic kid. My first Parker seminar, I think, was in 67 with my parents. I was telling somebody earlier on the podcast, I told folks I had a drug problem when I was a kid. I was drugged to every chiropractic seminar there was.
Oh, I like that. I'm going to use that. Me too.
Yeah, but I remember, Parker saying chiropractic succeeds because it's right. And, that sounds like, well, that's just a saying. But the reality is it over and over and over again, it does succeed because it is right. I mean, it is so rewarding to see what my mother and father said for years and years and years actually coming to fruition and it being proven and research supporting exactly what it's almost, I can imagine there's so many old time chiropractors that feel so vindicated saying, damn it, I told you so.
Well, and that's why I just wish I said, man, if my dad was, because the things that he said and that you can really see to come, but here's where it comes back to, and you can go all the way back to the Palmer. The body is an adapting mechanism. And depending on the stresses that you can place upon it, it can adapt the way that you want it to. So if you build a callus on your hand by rubbing it over and over, what happens if you don't do that? The callus will start to move away. So we've got to learn to do, like with chiropractic, if you give the body the ability to have proper mechanics, it's going to have less degeneration. Now realize we do so many things day to day, especially in our world with tablets and computers. It's no wonder so many people have upper cross syndrome. Can you imagine with chiropractic care, how much of that we would prevent from people doing that regularly and then doing a home program? It's not just about the adjustment, but what are you doing to adapt? If you bent over for 8 hours a day, doing 10 neck reps going the other way is probably not enough, but it's going to be a way of starting to realize that the body is the body's going to adapt one way or the other. You're going to choose whether it's going to be a positive or a negative. Chiropractic puts you on the path because we always understood that. If you really think of the philosophy, it's the understanding that if you keep the body in alignment, it functions better. That doesn't mean you are absence of never getting a disease or injury, but it's going to slow down or prevent so many.
Yeah, it sets you up for success if you'll do it. Well, hang tight, everyone. We're going to take a quick break to hear from our sponsors. Welcome back to our podcast with Sam Collins. Enjoying the conversation, Sam. You know, we see each other on these, we're typically on other people's, and we started this podcast. It was Christy and our team's idea, and I thought, man, what I want to do a podcast for. And, you know, I really find that I'm really enjoying them because I might see you at a seminar or a state meeting, but we don't ever get to go deep, if you will. And this platform really allows for that. So it's been a lot of fun for us.
Well, I agree with you. At first, as I podcast, I've become a kid. It's the new way of disseminating information. We're no longer determined by a one, like, oh, it's got to be ABC, or everyone has access. So you can find some. Now, of course, you got to vet a little bit to make sure someone's not way off the deep end on some things, but it's a good resource to get information. And the beauty for me is I'm a podcaster in the sense that I love to hear podcasts. So if I'm driving anywhere, it's how I spend my spare time. I'm just listening to it. I'm working in the garden. I'm listening. And it gives you a chance to really kind of dig into some things that it's not just the surface. So like when we do a seminar, like when we do our seminars, it's great. It's 8 hours. You're getting all the CE. But you know what we have the ability to do now? This is what we do with all our seminars. They're recorded. So if someone attends our seminar, not only can you attend it live, but you're going to get a copy of the recorded portion of it that you can watch, you know, however many times you want to. You can watch sections. And so I think in that way, this is where the technology and the ability to do like this podcast, it gives you something to really use it and use it in a way that's like, oh, shucks, I went to that seminar. I mean, can you imagine what if we were to go back and we had recordings of those Parker seminars, particularly those ones in the 70s where there's 10,000 people and I would love to hear some of that stuff because it would be fun to hear and see where we are now, you know, some 50 years later, comparatively, and that we're seeing that things that have been said, we can see that being true. And so this type of podcast, I think, does that because it memorializes it in a way that there's information. And we're giving them kind of, because we're the old guys. Now, that's one thing I've had to accept. I'm not the young guy anymore. But that they come in and then they take it a step further. And that's what I look to see. I'm looking for the young, I teach a lot of schools. And what I'm excited to see is the type of students we're getting, their backgrounds. I mean, it's not unusual now that every student entering chiropractic college already has an undergrad degree. That was something that wasn't true before. And I'm not putting down the ones of us that didn't have that, if you will. But again, it's just the continuation of the expertise. And I think it creates an acceptability of what we do, which in fact, by the way, I'm hearing that there is going to be a chiropractic college that's going to be attached to a major university. So now and this is not, I'm not saying life already isn't, but I think this is also where they're recognizing that, hey, this is not some just quasi information that people used to say. There's a real balance and there's a true science to what is done.
Yeah, I have heard through the circles I run in that there are a number of states that don't have chiropractic colleges, that their major schools are beginning to look at it because, if you look at the Bureau of Labor Statistics, I believe it was, their stats were chiropractic is poised to be one of the fastest growing professions in the United States, and there's going to actually be a shortage of chiropractors based on the demand that it looks like. And so, again, follow the dollar. The schools are going to offer what people are looking for, and everybody isn't going to want to travel.
Well, there's a shortage of medical doctors because they won't create more medical schools. They're trying to keep everything closed. Are you telling me a person that had a 3.9 GPA shouldn't be in medical school because they limit this? Chiropractic is filling that gap. We're in many ways, I think, what doctors used to, because realize chiropractors can be primary doctors. The patient's going to come to you. I know a lot of chiros that treat the community. I mean, obviously they're not doing medicine, but they're still having persons come in that they're checking their blood pressure. And if they need it, they refer them out. They're doing, if you will, functional medicine to keep them healthy. So chiropractors really are in many ways a primary source. Therefore, that's where people are seeking, because let's face it, if I'm going to go to if I need a surgery, if I have a broken bone going through my arm, oh yeah, I'm going to a medical doctor. If I need to learn about nutrition, being healthy, I'm not going to a medical doctor. They have literally no clue. In fact, all their thing is that you have to already be sick. Think of what chiropractic is always done on the sense of health and nutrition. We're the place to go.
And finally, the world is beginning to understand that. So when you're dealing with, you're sitting on these boards, I think you've been involved with Optum and certainly involved with the regulators, state boards, things of that nature. What do you see that trips doctors up, that gets them in trouble the most often?
I would say actually
top two or three.
The most common thing that doctors run into is often with patients not understanding the services. And it's one of the reasons we have the No Surprise Act. The biggest complaint among doctors, it always comes back to money. So a patient comes in, and I just had this call earlier today. The patient came and said, well, I didn't know I was getting why does it cost this much money? And it's something I think doctors have to be aware of, because they'll make a complaint to the board. And it doesn't mean that the board's necessarily coming, but when they get a complaint, they have to look at. And so they're looking at, well, what did you charge the patient? Were they aware of the charges? So I'd say, number one, make sure patients are aware of what the costs are. I think chiropractic sits in a good spot because we're less expensive. But the other area is that where doctors just do things that potentially go beyond scope. Be careful of telling someone with cancer you're going to cure it. I think everyone knows that. But I mean, it's surprising little things like that we run into. And then really probably the number one thing, though, is if someone makes a complaint, if you didn't document the visit properly, that's going to be a problem. Because you're going to state something, but if it's not in the notes, the patient is going to say, well, that's not what he said or did. They're going to side with the patient. Let's always understand, what is the purpose of the Board of Medicine or the Board of Chiropractic?
Protect the public.
To protect the public. So what are they going to start with? Protecting the public. Put yourself in a position where you do your consents, patients understand. I mean, chiropractors hurt very few people. Let's face it. As a chiropractor, you pay maybe $1,500 to $2,000 for $1 million policy. Medical doctors pay literally 20 to 40 times that for the same coverage. Clearly, we're not hurting people. Where we run into problems is issues of improper documentation. And probably the biggest factor that I run into, and this is one through Optum, and I'm getting ready to have a meeting with them. In fact, it's next week, my first year meeting. And we go through where we've audited. Now, I will tell you, people, I say, chiropractors are terrible at documentation, and I'll have to take, okay, we've got some issues in the profession. I always try to help that. But I'll have you know, physical therapists by nature have much poorer documentation standards when it comes to these audits. But the number one area, if you want to protect yourself from having a problem, please document the time when you are doing a timed service.
Yeah.
So if you're doing exercise, don't just write, I did exercise. Tell me, we did exercise with the patient for 22 minutes or 20, whatever it was. And then, of course, list what you've done. But the number one error where doctors run into a problem is that you just didn't document the time. Now, I will tell you, I've audited files that, in my opinion, I could look at it and see they did. The problem is without time, it doesn't count. So I would tell doctors, make sure you're documenting time. Also, make sure you're documenting your manipulation. Where are you manipulating? I would prefer you tell me what technique, because I know many of us do, you might be doing Gonstead, diversified, merit, whatever. Those are all, tell me what you're doing. Remember, for Medicare, you have to tell me the vertebra.
Right.
For other plans, you don't, but I would say, why not say the vertebra without it? Just keep it consistent. That way, no one's ever going to question, well, you said you did an adjustment. Don't just check a box. I did an adjustment. Tell me, I did a chiropractic manipulation to the cervical, thoracic, and lumbar spines. My preference is for vertebra, but at least if you state that, I always put what type, because I want to know, oh, last time did I do this technique with this person compared to other one? Because certainly over time, certain ones work better. And it's really just documenting what's there. I'd say that probably resolves it. There's not as much as people think. There's always going to be those people that scare you. Like one of my frustrations, this is my own personal opinion. If you go to a seminar where they start off with something like, if you do this, you're going to wear an orange jumpsuit, meaning you've done something wrong. Chiropractors aren't going to jail. They aren't. I mean, people commit crimes. If you just lie and say you did a treatment you didn't do, forget that. But no one's going to get in that much trouble for improperly coding. You know what happens when you improperly code? They
You pay
don't
some money
pay
back.
you.
Yeah.
That's
Or
well,
you pay money back.
I want to be paid. You're not going to jail for it. You're just not getting paid.
Yeah. When you talk about the common things that get people in trouble with boards and other regulatory bodies, I've told docs this for years. The most common complaints, and again, I've talked to a lot of folks at FCLB and a lot of different states and malpractice carriers, and it's really strange. Like you said, chiropractors don't really hurt that many people. The things that get chiropractors in trouble the most is not over your clinical care. It's not over misdiagnosis or failure to diagnose. It oftentimes is over dollars and cents. And one of the most common reasons for frivolous lawsuits for the malpractice companies is over dollars and cents, because somebody wasn't clear. They've had unrealistic expectations, or, we talk about the importance of giving a good clinical report of findings. We want patients to understand their condition, the consequences of non-treatment, et cetera, et cetera. But then when it comes to the billing side, we don't want to talk about money. You're not supposed to talk about that kind of stuff. And the reality is that's the landmine. And if you just take a few minutes to get that out of the way and have that conversation up front, and again, that's why there is the good faith estimate law now, because people aren't doing that. But it doesn't matter whether it's chiropractic or any other business. And I've read tons of stuff on this. The primary reason that people stop doing business with any company is over lack of clarity about their obligation financially. It's fuzzy. They don't want to talk about it. Yeah, and again, our healthcare system has bred that into us. I remember years, you go to the hospital and you never got it. I mean, there was never any talk of money. You always got the surprise bill, thus the law. But it just wasn't something that talked about. And I'm going to tell you, if you truly want to eliminate, probably, and I'm going to throw out a crazy number, you want to eliminate, like, Lysol talks about 99.9% of your risks. Talk about the money. Make sure
Well,
you're documenting it. You will
hey, let's say
literally eliminate your challenges.
I work with malpractice carriers, particularly ChiroSphere, and they do a whole program where they make sure if you're audited, you're protected. Well, one of the things they try to do is to make sure doctors go to coding and billing seminars to understand the ethics of billing, how to propose money, because just as you said, if you eliminate that part, that's almost always a complaint in a chiropractic office. That's where it starts. I'm mad over this. And then if they're mad over it, if the board then says, we want to see your notes and your notes aren't good, now we've got a problem. But if you just did it, and I think this is where you have to look at, you have to know the number one thing people want to know when they come into office is, how much is it going to cost? That's what they want to know. And you got to be upfront about it. They also want to know, is it going to help them? Now, truthfully, the better value you give them, the more they're willing to pay. Being cheap doesn't necessarily make it good or otherwise. And so if you get in there and you start giving them, here's what the costs are, here's the benefits of it, people want, and some chiropractors are really good at that. You manage the expectations and make sure people understand. Now, you're never, promising a cure, but let's face it, everyone's going to make some improvement. Then you make a decision, okay, well, how much are we improving what we're looking for? But as you said, if you focus in to make sure a person knows exactly what's going on, the expectations are met. There's not an issue. It's when that person goes, wait a minute, I didn't know it was going to cost this.
Exactly.
And now of course, once they do, now they're mad. They want to, make a complaint because it's the principle of the thing. Whenever someone says it's not the money, it's always
the money. So one final question before we get into some fun stuff. What role do you see AI playing in documentation and coding for chiropractic?
I'm not sure AI is going to come in for documentation, but I do think the use of an electronic system in a sense of you want to start to create, if you really look at a chart note, what are we really looking to put in there? And I think people overthink this. Be careful of overly templated language that you're just repeating the same thing. But if you go in and think of it, what does a soap note do? It's telling me a story. What is the S? How are you feeling today compared to last time? What can you do better or worse? That's really the S. So probably you can start to create where all you have to do is fill in a short blank that. Don't let the patient fill it out. You ever have a patient tell you they feel better, but yet the form they fill out sounds worse? So just do that. And I think this is where electronic records, I think anyone that's not using them should, because it can make your life so much simpler to do that. So keep in mind this, start off with the S. What's the objective? What did you see today? And if you think of it, I do certain things before I adjust. I'm going to check leg length. I'm looking at muscle spasm and range of motion. So I'm looking at those 3 or 4 things each time. That's what I'm putting in. My assessment is my diagnosis. So here's where it happens. I don't have to redo the diagnosis. It's already in there. And then the plan is just what I do for treatment. So I think it simplifies it. We're going to have a way to communicate. Like now, if I send an email, a lengthy one, or I'm communicating via text, I do it always via voice. And then I go back, I have an AI program that goes back to correct it, because in case semantics sometimes are out here. And boys, that made my life simpler. I think the other thing that it's going to do, though, is it's going to give you an ability that, and here's, I think the biggest change is going to come to radiology. I don't think there's going to be radiologists in 10 years. And I say this because what they're doing now is they're uploading literally billions of x-ray films. So what you're going to do is you're going to take your x-ray, upload it to this system, and then it's going to come back and tell you exactly what's wrong. They found already it's finding when someone has cancer. AI is way better at finding, because right now there's always that one person that's really good at it. Well, what they're doing is putting all that data in. And so I think it's really going to help resolve for many of us having an issue with how we see those things. And I'm not saying it's going to take over how a doctor sees someone, but it's going to take away a lot of all those little nuances. I mean, think of billing now. Here's one way it's going to really help. There's programs now, as you document into the patient's file, what you document automatically goes to a bill. Then all you have to do is approve it being sent. You don't have to do anything because it's already set up in there. All you have to do is go back and make sure it's correct and hit send. Imagine how simple that would be. And then you never are coding something that you didn't document, because you have to document it before it gets coded. So I love that. So I do think that's where
yeah. Well, I got a couple of just for fun questions. Who's your hero and why?
Who's my hero and why? Oh, well, for me, I'm gonna have to go back, and I mean, this will sound, self-aggrandized, but it's going to be my pop. He demonstrated to me something early on with his health, and unfortunately, he had Parkinson's disease. So that was a whole nother thing. But whenever anyone saw my dad, they would always go, "My God, man, your dad looks so young." He was really very muscular, and he passed it on to me, but he didn't pass on the DNA. I'll tell you what my dad taught me and why he's my hero: discipline. Now, people look at me now and they'll go, "Well, gosh, Sam, you look very young." I mean, I was an Olympic athlete and all that. And so, but I'm 64 and I always people go, "Wow, you look much younger." You know why? I've never not exercised. I mean, from the time I was 5 years old, I lifted weights. And that was back when, my dad was named Sam. Don't let your son do it. You're going to get muscle bound. He's like, "Get out of here. You don't know what you're talking about." Always had a healthy diet. And I've always taken some levels of supplements. And that discipline of life, and then seeing how that permeated to the profession in what he did. And that's what my dad enjoyed. The one thing he said to me, this always stuck with me. I was with him at a party and someone had a headache. I was probably 15. He took them to the side, adjusted their neck. The headache was gone. And he goes, "Now look at what I was able to do." And that always stuck with me. In fact, this person he did that with, I still see her occasionally. And she talks about how my dad was instrumental in her life and changing, because it was a time where she would be disabled. And I think that part of it, it's not just the lifestyle and the discipline, but also what he did as a profession. And it's really thankfully brought me to a place where I have a good life. My dad did well, which means I've done well, which means I've been able to pass it on to my kids as well. Chiropractic has been really good to me. And from that standpoint, that's why my dad is that hero, because he taught me what it took to do that. And for me, all I had to do was kind of step in his footsteps. I hope I've extended them a little bit, but really it was an ability to follow what I saw him doing.
That's awesome. What talent do you have that most people don't know about?
Ooh, what talent do I have? Well, forget about the athletic side of things. I mean, that's probably, beyond, but I would say what talent I have is probably one that people don't recognize it, but I'm a heck of a dancer.
Really?
It's always been the case. And I'll tell you why though. When my
All right. I'm sure there's got to be some TikTok or YouTube or Instagram reels out there,
no,
Sam.
I'm not a TikTok person. I don't like to put a lot of stuff of that out. But let me tell you why though. I was 9 years old and my sister turned 16. So my parents had a sweet 16 birthday party. And I remember all the girls, there was a bunch of people at the house and all these girls were excited because this guy, I think his name was Gary. Gary was coming and Gary did a dance. He said, I can't do it. When he danced, literally every girl screamed and was in love with him. At 9 years old, I realized the way to get a girl, be a good dancer. So I
That's
literally would watch all the, American Bandstand, Soul Train, and I would mimic those. So I was a hell of a dancer. I still do. I can do almost every dance, but it's simple
awesome.
because it was a good way to get the pretty girls.
That it's funny what motivates us. We always say follow the dollar. Well, there's something else that-
Yeah.
it's
When I
just-
saw, I'm not even sure
it's
how
all
much
about.
I was only 9, but I
Yeah.
was old enough to recognize, this is probably a good thing.
Well, thanks so much for spending some time with us today, Sam. And thanks to everyone for listening to the ChiroSphere podcast. Please subscribe and share the podcast with your friends and let us know who you'd like to hear from in the future, what topics you'd like us to cover, and we'll do our best to deliver. If you want to learn more about ChiroHealth USA and how we can help you develop a compliant, profitable discount strategy that will absolutely grow your practice, increase your income and profitability, call us at 888-719-9990 or visit our website at chusa.com, that's CHUSA.com, to find out why ChiroHealth USA is the network that works for chiropractic and you. Thanks so much, Sam.
Okay, you're welcome, buddy. Take a look for me, hjrosscompany.com. Thanks for having me.
All right.